Hello everyone, welcome back to our GEM clinic at Harley Academy, and we've got a really good first case for the clinic today. We've got Ciara. Welcome, Ciara.
Hi.
So we're going to do a little bit of a consultation on camera. I know that off camera we've just gone through all of your history, done the consent form, but what I want to do is have a really honest chat with you about why you're here for treatment and what you're excited about, what you're nervous about, everything like that. Then we'll make a treatment plan and then we'll go. The first thing I want to say is that Ciara actually works with us at Harley Academy. She's one of our senior marketing team members, and so she's very familiar with the world of medical aesthetics, but this is the first time having any filler treatment.
Yeah, first time.
So tell me.
Well, for me, it's the under eye area. It's always been something I've been insecure about. I had a series of polynucleotide treatments, which I was really impressed with, but I think it's just something that's obviously not going to replace volume. So I think as well, I've got my dad's structure, and my dad is lacking a lot of midface volume. And I can tell as well with that within my own face, when I smile and everything, my cheeks just aren't as prominent. So I think I lack that kind of structure. And I'm getting married next month.
That's what I was hoping for. Okay, so no pressure, but how many weeks is it until the wedding?
Is it 6, 7?
6 weeks.
7 weeks till the Portugal wedding.
Okay, good. So I would say kind of 6 weeks is my cutoff before any major life event. Usually all of the filler and any kind of residual bruising or swelling will have settled within 2 weeks, but I like to probably give it 6 weeks before any major event. That would be my cutoff. So Ciara's just about made it in time for our clinic today. So let's talk through kind of what I see when we assess, and I'll talk you through what I think opportunities are, and then we can agree a plan.
Yeah.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
Just tell us how old you are, Ciara.
31.
31. Okay, so let's just take a little pan across Ciara's face to start with. So Ciara's got very beautiful features, really nice skin kind of radiance, good skin texture, very symmetrical features, very typically feminine aesthetic features. And so we're obviously working from a really fantastic baseline. And what we're working on here is opportunities to really add additional moments of beauty and enhancement. I don't see any particular age-related volume loss. She's only 31, and a lot of that process happens later in life. But when I do assess, I do notice a few areas where I can easily enhance. And let's work our way from the top down, okay? So even though she has a very smooth kind of muscle pattern to the upper face, if you give us a really big frown, angry, and raise up as high as you can, there's still some movement. And Ciara wants to have some toxin today. We can do that. I would just say that we don't really need to be very strong with our toxin dose at all, because her muscles are already kind of quite relaxed and we have this beautiful smooth forehead. Moving just to the temple slightly here, just notice that there is a little bit of a opportunity. I wouldn't even say this is a hollow temple at all, but I can tell from the fact that the eyebrow is starting to push downwards a little like this, that if we added some volume, just turn a little, into the temple, we're going to get a really nice lift to the tail of the brow. And I think that will be very important for the treatment plan I'm planning, which is to try and give this lateral lifting approach. So I think temporal treatment will be very beautiful. Cheekbones are very well defined, and these don't change with aging. So if you have really nice cheekbones, that's always going to be the way for you throughout your life. But what I do see is that just as we get to this far lateral posterior aspect, I can add a little bit of structure to give even more lift and definition, which I think will be very beautiful. So I think that would be a nice treatment to do today. Continuing laterally, we then have just a little bit of loss of definition at the corner of the jaw. We do have a beautiful jawline continuing all the way to the chin, but this area here, generally, if I add some volume, what I expect it would do is just create even more tightness and definition along that lower third. And then once I've done that, I can then move to the under eye area, which is Ciara's primary concern. She's mentioned that she's had polynucleotides there, which have temporarily helped, okay? But if we're going to use volumizing filler, or in this case a very low volumizing filler, we're going to get a much more long-lasting and effective treatment to the under eye, providing we inject it well in the right place with the right product. One thing I just want to assess here, if you just close your eye and I press on the eyeball like this, you just notice a tiny bulging underneath the eye. And the reason for that, you can open your eye, the reason for that is that we have little fat pads within the orbit, the intraorbital fat pads, that when you increase the pressure, they push downwards and you create these little mounds. These would be called eye bags, okay? So these are eye bags, and she hasn't got aging eye bags, but she's got an anatomy such that these little fat cushions have a tendency to push downwards. And what that tells me is that that's, first of all, one of the main reasons she has these shadows under the eyes. The second thing is that it's going to be challenging to create a really perfectly smooth transition from the from the cheek to the lid. And so we have to just bear that in mind. A lot of what we're doing with filler in this scenario is we're just smoothing that transition. There isn't a huge obvious amount of volume loss. And so I'm not going to be aggressive at all in terms of replacing volume in the anterior cheek or the under eye. So once we've done all of that, we'll bring Ciara back in 1 to 2 months' time, and we'll have a look at how it's all looking. And potentially there will be a part 2. Potentially Ciara will be very happy and want to stop there. Does that sound good?
Sounds good.
Any questions?
No, sounds good.
All right, let's get started. Okay, so let's start off by marking up the treatments that we're going to be doing today. So if you can just come off the bed slightly, look into the camera for us, and let me start off by identifying the key landmarks for the temple. So first of all, draw on this temporal crest. This is where the frontal bone drops off into the temple, and I'm going to do the superior border of the zygomatic arch, and we'll connect those up. So this becomes our temporal fossa that we can treat, and you'll notice that the hollow point, the deepest point, is around here. Okay, and it's quite a narrow area of volume loss. Let's call it volume loss, but there's really no specific point that is telling me where I would like to create an injection. One thing that I do see is the visible superficial temporal artery, and you can see that pulsating just under the skin. This is a really good example to show you this artery. If I just tap this artery here, you can see it enlarge, okay? And this is a crucial artery for temporal injections. You can see this moving up the temporal fossa like this. And if I just very gently put my finger on top of it, I can feel a pulsation. So this is the superficial temporal artery. It's a branch of the external carotid artery, and it's supplying the lateral aspects of the face, and it also then moves and supplies the scalp. This is moving within layer 3 of the tissues, and so I'm very mindful with any injection that we do in the temples that I'm not going to be interfering with the superficial temporal artery. The reason this is such an important artery is because it can also have branches, these frontal branches, that then connect with the supraorbital and supratrochlear arteries. And if we have these anastomoses, then theoretically any connection to these arteries can connect to the internal carotid circulation, and therefore have these theoretical risks of vascular complications that affect the retina and can cause things like blindness. Now, I don't like to say those when my patient's about to have treatment, because these are extremely rare considerations, but they're always part of our consent form when we're talking about dermal fillers. And in this case, I am feeling the superficial temporal artery, and I don't feel any frontal branch moving through to anastomose with these internal circulation vessels. I can't palpate any artery moving that way, and so that's important because I don't have an artery moving directly across where I would want to do my injection. In this case, I'm going to use the 1 up, 1 over technique. So we find our 1 centimeter up and 1 centimeter into the temple. So just here is where I'd like to do my injection. And that will then give me a point which I think will help to create maximal elevation to the tail of the brow. This injection is down onto bone. It's a deep supraperiosteal injection. And for this, we're going to use a 25 gauge needle. So the needle size that I'm using is slightly larger than the one that we would find within the filler package. And the reason for that is because if we have a larger needle, we can improve the sensitivity of the aspiration. And in doing so, we have another way to try and improve safety with our injections. So final things is I just ask the patient to relax their jaw muscle, their chewing muscle, their masseter. That reduces the tension deep in the temple. I'm confident with my location of my injection. Patient takes a nice deep breath in and breathe out. And we touch down onto bone like this. Okay. And from this position, I'm going to do a nice 10-second aspiration. So there's no flashback in the hub of the needle here. So I'm confident now that I can now slowly inject this product, which is Reveness Shape. You'll notice that my injection angle is also at a 45-degree angle. I'm not perpendicular. That also helps to retain the product deep down underneath the deep temporal fascia when I'm injecting. The injection pressure is very slow. That also improves the safety of the injection, and it helps the product stay deep where it's intended as well. Okay, so this is half of the product that's gone in. What I'm going to do now is just slowly move out the tissues, and then I always like to apply some gentle pressure onto where I've injected in case there's a deep venous bruise that wants to appear. 20 seconds of pressure immediately after any temple injection, even if there's no bleeding at the injection site, I find is a worthwhile thing to do. How was that, Ciara?
Yeah, absolutely fine.
Pain out of 10 for that one?
1.
1 out of 10,
Yeah.
Okay. So it's a good start?
Yeah, really good.
Okay.
I was expecting less.
All right, so now let's just move some of these markings off. Turn towards me. Perfect. And I think that we can see an improvement already. If you just sit you forwards and look into the camera for us, let's see if we can see this on camera. So I just want to turn, you can hopefully appreciate here that the eyebrow here is just a little bit higher as we've started to create some more tension deep underneath the connective tissues of the face, the layer 3, for example, and that's starting to give us a little bit of lift and elevation. Really big smile as well if you can. Okay, and relax. Perfect. So far so good. The next thing is now to try and create a tiny bit of subcutaneous definition at the cheek, and we're going to also then create this same traction laterally. Generally, when we're injecting the face in sequence, we're going to start lateral and move our way medially. And so these are both good examples of injecting lateral to this line of ligaments moving through the face. And in doing so, the research has shown that if we start this way, we need less volume medially to get the same result. So what we're going to use is a cannula now to treat in the lateral aspect of the zygomatic arch. Back. And this product we're going to use here is Reveness Contour.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
So I can feel here the underside of the zygomatic arch, and this is the superior border. And so I know the direction that I want to create. I'm not going to be injecting deep here. I'm going to be doing an injection just under the skin to create this really nice definition. And the reason I'm comfortable injecting just under the skin like this is because if you give me a really big smile and relax, you'll notice that this part of the midface isn't mobile, so that it won't move around if the patient smiles. This is part of what's called the static midface, and so it's okay in this region of the face to inject just under the skin. Using a 22 gauge cannula now, and make a little entry point here, 1, 2, 3. That needs to move just through the dermis, and we're now ready to follow the cheekbone in this same direction, and the majority of my volume is just going to be moving laterally where I want to create this enhancement, this little extra ridge of definition along the zygomatic arch. Maybe 0.3 mils in total to really help with the shape. Whilst I'm here, I'm going to add some volume into the lateral cheek fat in this preauricular and subzygomatic region, and I'm just going to pass, staying in the subcutaneous depth, I'm going to move to add some volume, which will additionally help with creating lateral tension across the midface. But this is a smaller and more diffuse amount than the cheekbone that I've created, which is really going to be specifically for that additional aesthetic benefit. You'll notice as I'm injecting, there's just a little bit of resistance as I move through the subcutaneous depth, and that's intentional because we do have little fibrous divisions between the fat cushions in our subcutaneous layer, or layer 2. Now I've got Dr. Max with me, who's mic'd up, so I can also have a little chat with Max. How are you today?
I'm doing very well, thank you.
Excellent.
I love using a 22 gauge cannula here, not just from a safety perspective, but because you can so clearly see the outline of it as well. It's quite easy, particularly with newer injectors, diving a little bit too deep, and then you end up in the prostate gland. So using the 22 gauge, staying nice and superficial, always seeing the outline of it, is a really useful way of making sure that you're safe, but also that your product's going into the right place to get a good aesthetic result. And in terms of entry points as well, this is quite a universal entry point. From a single place, you can treat the zygoma. You could also treat layer 4 in the zygoma, the apex, all the way down to the mandibular angle.
Brilliant, thank you, Max. And you'll notice here, look, there is very little irregularity underneath the skin. Ciara's got nice, thick, youthful skin, but even so, I'm using Revolved contour. It's a very moldable and soft product, while still having that medium level of lifts that we need when we're trying to do this kind of treatment in a younger patient. So that all feels like it's in the right place, and it's nice and smooth and even under my finger. And then I'm just going to use my finger here to create a little bit of definition along this new cheekbone. And let's take a look at what that's achieved. If Ciara can then look into the camera again. Straight ahead into that camera for me. Beautiful. So nothing dramatically different, but I hope you can appreciate also how nice it is to have that little bit of additional aesthetic cheekbone definition compared to this side, which is a little less defined. So when we're looking front on, her cheekbone on this side is a little higher up than this side. And that's all contributing to this beautiful feminine V shape of Ciara's face. Give us a really big smile, please. And relax. You'll notice that it still looks very natural on expression and animation as well.
I think it's actually helped the under eye area already by adding some tension to the orbicularis retaining ligament. It's made it appear soft already, which is exactly what we want. It means less filler in the under eye area, lower risks, better aesthetic result.